As early as now, parents and guardians of minors with comorbidities have already started enlisting their children on their LGU's master list for pediatric vaccinations. But the DOH warns rollout of vaccines for 12 to 16-year-olds will still depend on availability of shots. Greg Gregorio with the report.
And battled the infection for about 3 weeks. But since Karen was already fully vaccinated since July, she worried less about her condition. But that's not the same case for her unvaccinated son.
I actually was more worried about him more than myself. So we had to pump up on a lot of vitamin C, more on fruits, and a lot of rest.
Miggy is 15 years of age, and his age group is not yet part of the government's vaccine rollout. That's why for Karen, it's good news that the health department is now targeting to pilot the pediatric vaccination of minors with comorbidities aged 12 to 17 starting October 15. Karen has been trying to have Miggy registered for vaccination in Antipolo City, especially since he also has an underlying condition.
We're checking it every now and then. Yeah, that's how I am that's why I'm very hopeful that, soon this kids would be allowed to have that vaccine as well.
Meanwhile, in the municipality of Pateros, registration for the adolescent population has been running for 3 weeks now, and about 2,500 or 25% out of their target population are already registered. Pateros Mayor Miguel Ponce believes numbers will even increase once the rollout starts.
Kapag bibigyan nila kami ng sufisyenteng bilang ng Pfizer at Moderna, sisimulan namin ito sa mga 12 to 17. After all, tapos na kami sa ating general population ng 18 above. Sakaling ito ang maging susi para naman simulan din natin yung face-to-face classes ng mga bata. Di ba?
According to the Health Department, official guidelines for the vaccination of 12 to 17-year-olds are still being finalized and may be released next week. Once the rollout starts, the agency wants to make sure that every adolescent and guardian will make an informed consent before receiving the jab. Health Undersecretary Maria Rosario Vergere also clarified that this rollout still depends on the availability of vaccine supply. She reminded the public that only COVID-19 vaccines from Pfizer and Moderna have an emergency use authorization for the inoculation of 12 to 17-year-old age group.
Kailangan may medical clearance po ang ating mga children na may comorbidities either from their attending physicians or their specialists, o kung wala po silang access sa ganitong clearance, maaari naman po yung doktor natin dun sa kanilang local area. Pero magbibigay po tayo ng checklist provided by the Pediatric Infectious Disease Society of the Philippines para po tayo ay matulungan dito. Pangalawa, kailangan din po ng informed consent at saka assent.
The government's vaccine cluster expects the arrival of 114 million more doses of COVID-19 vaccines from October to December. Vaccine Czar Carlito Galvez Jr. said that out of 30 million doses arriving in October, more than 15 million are Pfizer vaccines, while 5 to 7 million are Moderna shots. The plan is to pilot the vaccination of 12 to 17-year-olds with a comorbidity in NCR by October 15. Galvez highlighted this will initially be rolled out in 5 hospitals including National Children's Hospital, Philippine Heart Center, and Philippine General Hospital.
Very cautious ang ating gagawin sa children vaccination. Gagawin natin itong dahan-dahan, very phased, at saka incremental.
The government is also targeting to start vaccinations of more adults from the general population next month, a move that will be piloted in regions outside NCR. The goal is to vaccinate 77 million of the target population until December, 7 million of which are the adolescent population. For News 5, Greg Gregorio, we are One News.